Hello, good morning. I'm going to assess the thorax and the lungs. In this assessment, we will include the posterior and anterior thorax. So, the equipment we will use is the stethoscope and the tape. So, that's it. So, let's go. Good morning, ma'am. I'm Yvonne Bermilio, nursing student in Fugao State University. So for today, ma'am, I will verify your name. What is your name, ma'am?
I'm Nicole R. Panisa.
About your birthday, ma'am?
December 25, 2018.
About your age, ma'am?
I'm 19 years old.
So before I start explaining the procedure, ma'am, can I ask po kung ano pong gusto niyong itawag po sa inyo?
Okay lang yung real name ko. Just call me Dimple.
Okay, ma'am, Dimple, ma'am. Ano po yung gusto niyong language na pag-uusap natin, ma'am?
Tagalog na lang po.
Okay po. So dito, ma'am, i-interviewin ko po muna kayo para ma-collect po yung subject data nyo. Okay yun sa inyo, ma'am?
Yeah.
So for the current symptoms po, may difficulty po ba kayo sa paghinga, ma'am?
Wala naman po.
Okay po. How about po sa chest pain po?
Wala din po.
Sipon po, meron po. Sa past history po, may prior respiratory problems po ba kayo?
Wala.
How about po sa previous thoracic surgery biopsy?
Wala din.
Sa allergies po, meron po ba tayong treatments na ginagamit na medication?
So far, wala din po.
So, how about po sa pulmonary study test po, meron po?
Wala din po.
Nagkaroon po ba kayo ng x-ray? Previous po.
Hindi pa po. Never.
Skin test po, meron po.
Hindi din po.
For the family history po, wala naman po kayong lungs disease?
Wala.
So before I start, ma'am, I'm going to use alcohol for hygiene purposes. And I'm going to... For your privacy, ma'am, I will close the curtains, ma'am. First, we need to inspect the shape and symmetry thorax from the posterior and lateral views, and then compare the interior diameter and the transverse diameter. Okay, so thorax is symmetry. And then, next is to inspect the spinal alignment. Ma'am, pwede po ba kayong tumayo? It's three normal curvatures, that's cervical, thoracic, and then lumbar inspect. So spine is normally aligned, and next is I'm going to palpate the posterior thorax. So it's normal and no swelling and tenderness. And then next, I'm going to palpate the posterior chest for respiratory. So, take a deep breath now. Once again. So normal naman siya since nakita niyo naman yung tongue ko na nag-move. Next is I will palpitate for the chest for vocal frenitus. What can you say
1999? Well, it's
The next is I'm going to auscultate the chest using the diaphragm of the stethoscope.
well, it's
So the findings are just normal. So okay naman siya. Next is I'm going to percuss the thorax and percuss the diaphragm excursion. So if I will this ma'am, I will do this ma'am, you can take a deep breath as I go on.
well, it's
Okay ma'am? You can in and out ma'am. Hold it ma'am. Release ma'am. Release ma'am.
well, it's
So okay. So it's a normal kasi 5 cm siya. Nasa 5 cm siya.
well, it's
So let's proceed to the interior thorax. First is we need to inspect the breathing pattern. Inhale, exhale, exhale, inhale, exhale. So I can see that the breathing is just a quiet and it has no effortless to respiration. And then next is we're going to inspect the coastal angle and the angle at which the ribs center. So it's a normal naman because the coastal is 90 degrees angle. Next is we're going to palpate the anterior chest.
well, it's
So it's just a normal. And then we're going to palpate the anterior chest for respiratory excursion.
well, it's
So it's just a normal. And then we're going to palpate the tactical firmicus in the same manner as the posterior chest.
well, it's
Inhale, exhale. Inhale, exhale. So it's normal again. Next is I'm going to percuss the anterior chest systemically.
well, it's
So it's just a normal again. auscultate the trachea using the stethoscope. I'm going to use the diaphragm again, ma'am.
Well, it's just
And then last, we're going to auscultate the anterior chest.
well, it's just
And lastly, I'm going to document all the findings in the health record. So that's all. Thank you for your time. So that's end of my assessment, ma'am. Thank you for your time.